This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister. I'm not board certified or Dr. Schmachter in anything. I'm here because I'm a pet lover, owner, and rescuer. And we're here to help you become the best pet owner you can possibly be, to give you some science-based factual information. And we have some amazing guests. And Alice, who do we have today?
well, first of all, I have to tell you a little story. I was walking the beach the other day, and I was listening to this wonderful webinar on intervertebral disc disease. You know, when you blow a disc in your back.
Thank you, because I didn't know what the hell that was until you got to disc.
Okay, thank you. IVD disease, and like I did to my L5.
Yeah, I call it, yeah.
So anyway, I got home, and I'm like, who was that? The veterinary neurologist is Dr. Missy Carpentier. I think I said that right. She is a veterinary neurologist in Minnesota.
Cool.
And building and opening her own clinic. Kudos to you, Dr. Missy, because I did the same thing, and I'll pray for you. But it was still fun at the same time. She is the founder of Minnesota Veterinary Neurology, which is a specialty hospital for neurology only. And I can't tell you, Janet, from a veterinary point of view, how much that is needed. And that's one of the things I want to talk to Dr. Carpentier about today, because she brought up so many good points about the most popular breed right now, which is the French Bulldog,
right,
and how it's like a little dog packed into a little skeleton. So welcome. If you don't mind, if I call you Missy, welcome, Missy, to the show.
Oh, thank
today.
you. No, I'm happy to be here. It'll be a great topic and much needed.
Give us a little bit of your background, please.
Yeah, so I actually grew up on the East Coast. So I grew up in Boston, just north of Boston. I ended up going to Ross for vet school and then finished up in Minnesota, where I met my husband. So we have sled dogs, so we'll never leave Minnesota. So my husband stayed put in Minnesota. I went to do further training. So I think one of the main things is, you know, how do you specialize as a neurologist? Well, you do your 4 years of vet school, but then there's a whole bunch else that you got to do. So I did a 1-year rotating internship back in Connecticut, and I did a 1-year post.
Wait, where were you in Connecticut?
I was at a VCA in Connecticut.
Which one?
Right at Shoreline.
Okay, I live in Darien.
Oh, okay, cool. Yeah.
We now have a VCA.
Got it.
We now have one. Yeah.
And so I was there, and then I went and did a year postdoctoral fellowship in Missouri, where I then stayed to do my residency for an additional 3 years in neurology. And then I got to go be a real doctor and practice as a neurologist. I headed back to Minnesota, where I've been since. So been practicing in the area for almost 9 years. And then decided kind of this last year to venture out on my own to be able to practice veterinary medicine exactly how I want, to be able to help as many pets as possible.
And Janet, I have to shout out to her, because I owned my own practice, a sole practitioner as a specialist, non-corporate. I'm so proud of you for doing that. I really
Thank
am.
you. Thank you. Yeah, I've come to learn that there's not too many of us out there, but hopefully it'll change. Yeah.
Wow. So what are some veterinary neurology issues? Like, what are the main ones in?
Yeah, so the main thing that we'll see, seizures, of course. That's definitely one of the most common medical conditions that we treat. So what's interesting with veterinary neurologists, is we do both medical and surgical neurology. Whereas in human medicine, you'll go see a medical neurologist versus a neurosurgeon. We actually do both, which is really fun because we get both sides of it. So on the medical side, seizures by far is the most common what we see. But we also do a lot of surgery, and we do surgery because dogs have really bad back pain or neck pain, or with secondary to a disc herniation, or potentially meningitis, or they come in and they have a really bad case of vestibular disease, which we usually think of as vertigo, right? You get off the roller
Right.
coaster and you're so dizzy, and dogs can present with that as well. Different tremor syndromes. There's a whole bunch that we'll deal with. Basically anything associated with the brain or spinal cord, and then also anything with the muscles and the nerves.
So how?
Janet,
But as a-
Janet, the other day I wanted to tell you,
Yeah.
I help out, I'm in Florida right now, and I help out the Lee County Sheriff's Department Animal Abuse Unit. So any veterinary question, they call me. And I had gotten in touch with Missy the other day because one of their golden retrievers, their 3-year-old golden, that kind of calms people down and calms kids down when they're from abusive environments, all of a sudden is just having a off and on head tremor, not like every day. And so, I'm a dermatologist,
Yeah.
okay? So
Yeah.
I immediately emailed Missy, and the nice thing is, and Missy, I think you'll agree, now if they can video
It's
it,
huge.
it's such a help to you.
Yeah, it's really changed the way, we deal with seizures and tremor syndromes, honestly, because it makes it so easy for us. Because it can be really hard to say in words what you're seeing, especially as an owner. I mean, my own personal dog had seizures, and I mean, one of the first things I would say is the seizure, it lasted 10 minutes, when in all reality, my dog's seizures were always less than a minute, but it felt like eternity for me. And I think now, owners are realizing too, but it's so helpful with the videos, you can say, oh, wait a minute, that was only so long, and this is what was happening, and this is what was going on. So it makes diagnosis of what actually is happening, much more feasible for us, because our patients can't say, hey, this is how I was feeling beforehand, and then this happened, and this is how I was after.
Well, that's my question. Like, how do you know your pet is having a neurological issue?
Yeah, and so much comes from the owner, right? Like I will always say they know their pet best. The number of times that I see pets as a second or third opinion, and they just say something is not right. Like, I can't put my finger on it. I don't know what it is. And we'll go through everything. And even if, I might find a normal neurologic evaluation, and I'll say, okay, you're telling me though, like, something isn't wrong, so let's see if we can figure it out. And the number of times I've found something going on in that pet's brain, whether hopefully it's not commonly a brain tumor, but that can happen in certain areas, versus if they've got a disc herniation and it's causing them pain, this chronic pain, and they may still be walking good and everything, but something is off. And it happens time and time again. So the owners really are the key players. I mean, there may be obvious, and a lot of times there are obvious signs, hey, my dog won't shake its head anymore because its neck hurts, random screaming or crying out, my kitty's falling over because it has a head tilt, or my pet isn't jumping up anymore. Those are very common and classic signs that we'll see, and the owners will find that. Then usually they'll go into their referring veterinarian or their primary veterinarian, and they'll be able to say, oh yeah, this isn't right. And they can either try to manage it, or in those other situations, they can always reach out to a local neurologist.
Wow, I had no idea.
Neurology kind of reminds me of the immunology part of what I do in Durham. It's like something new all the time.
Yeah, and I will say,
I mean,
I practice in Minnesota, and during my residency in Missouri, I honestly only treated like a handful of cats. And so what was really interesting when I came to Minnesota is I treat so many cats in Minnesota. Minnesotans, Wisconsin.
Like, what's the most common neurologic problem you're seeing?
Yeah,
in
with
I
cats?
see very commonly vestibular disease. So they like to get otitis media quite a bit. So an inner or middle ear infection. And that infection actually can extend into the brain pretty commonly in kitties. And so, cats are cats. They're going to do whatever they want. So they can be walking around with a brain abscess, and the only thing they have is a little head tilt. But they can do remarkable with treatment. But it really was learning a lot of new conditions that you read about in a textbook, but you weren't necessarily seeing. And in Minnesota and in Wisconsin too, we see so many kitties. We see them for seizures. We see them for disc problems. Aren't as common, but they absolutely can have disc problems as well. Just dogs by far are more commonly going to be the ones that are in a vertebral disc disease.
What's a head tilt? Like the cat's like
Yep,
this?
they're looking at you like this. So their balance is off. So usually they'll have a head tilt to one side. Their eyes, we call it nystagmus. Their eyes may be moving back and forth or up and down really rapidly. So you just look at them and you can just tell, oh, these poor things are so dizzy.
Something's wrong, yeah. We have two cats and a dog.
On that note, tell us about the thing that I had a high school classmate of mine, again, dermatology, but asked me about neurology. He has a 15-year-old black lab and woke up one morning with the head tilt and rolling
Oh.
around. And tell me about that.
Yeah, so in your older dogs,
That's
you
not
kind of
uncommon.
you hope in that situation what's caused that is what we call old dog vestibular disease, where usually it's a condition where our older patients, and we call it idiopathic, and I'll always tell my owners that's a fancy word for us just not knowing what's actually the underlying causes, but we give it a name. And so luckily it's not a sinister cause though. So for some reason that old dog has an acute onset of vertigo, and the good news is usually they're going to improve over several days. They may always have a residual head tilt, but a lot of the times in those older dogs, it can come on very suddenly. It's very scary, but they can do great. Now, of course, there are other more concerning things that can cause that in an older dog if they potentially had a stroke, what we call a cerebrovascular accident, unfortunately a brain tumor and those things. But usually in those really acute cases, luckily a lot of times it'll be that old dog vestibular disease, and they can do good with just time and supportive care.
So you don't rush to do an MRI on those. I mean, do you say, let's give it some time?
I think it
before-
depends on the owner and it depends on the pet, and how, kind of what their condition is and where my gut is telling me if I'm more concerned, if they have, maybe they're a patient that I'd be worried would be predisposed to have strokes or vascular accidents, then maybe I'd say, hey, let's see what we're dealing with so that we know. Granted, with the stroke, a lot of times the dogs also will do fantastic, but it's good for us to know so we can be trying to make sure we're treating the underlying metabolic problem. I'm always a need to know person, so I always think that it's great to do an MRI, but a lot of times in the older dogs too, I'll talk to the owners and say, hopefully this is, what it is, as long as everything else is telling me that their brain isn't involved otherwise, because we can always go more into it, but when we are looking at a patient that is really dizzy, we say it's either peripheral or central vestibular disease. And so mainly that means something going on outside the brain, which is what we want, of course, or inside the brain. And those old dogs with classic old dog vestibular disease should be presenting as something going on outside the brain. So in those cases, I'll usually say, hey, why don't we give it some time, support, and see where we're at in a day or two, as long as things don't progress.
Oh, that's so sad. Yeah.
Wow. So as a pet owner, say my dog is having a seizure, I guess one of the best things to do is to grab your phone and do a video, because that's going to help the veterinarian.
Yeah,
right?
it always is. And I'll always say there's no way you're going to probably get that first seizure your pet has on video, because you're going to be so freaked out. And it's understandably
That's
so.
true.
You're just
I'd be
going to want to
freaked
make
out.
sure your pet is
No,
okay.
that's true.
So
Right.
if your pet does have a seizure, the biggest thing you can do is just trying to make sure they're in a safe area, so that if they're by stairs or on the couch or anything, we just don't want them falling off. There's nothing you can do to get them to come out of it faster or anything like that. A lot of times they're going to drool, they're going to urinate, they're going to defecate sometimes too. And it can be really scary, but know that most seizures last less than 2 minutes. It is not common for a pet to pass from a seizure unless they go longer. We start to hit a 5-6 minute mark and we get concerned. Because their overall body temperature will go up, but most seizures are going to last in less than 2 minutes. So it'll seem like an eternity, but try to keep them safe.
Right.
And then once they're recovered and doing okay, definitely following up with your veterinarian to see what you need to do and what's going on, versus if you have a neurologist nearby, you of course can always reach out to them as well. But there's a lot of dogs in the world that has what we call idiopathic or genetic epilepsy. So there's a lot of dogs out there that have just been born with a seizure disorder. Border Collies, Aussies, Labradors. I mean, any purebred dog has the potential basically to be what we call idiopathic or genetic epilepsy. But of course, there's many other cases. So you just want to make sure they're safe, they recover okay. Most dogs and cats after a seizure, think about it, they just expended a ton of energy. They used up all their glucose. They're thirsty, so they're going to want to eat. They're going to want to drink. They're going to want to pace around and kind of get their bearings again. So that's very, very common how they'll act afterwards.
Will they be the same? Do you know what I'm saying? Or is there a change in
So
the dog
most
after
patients
this?
will totally return to normal, but it depends on the timeline. Some dogs, I have owners that say it takes them a minute and then they're back to themselves. Other dogs, it can take a day. It all depends. Some dogs will have visual deficits immediately following the seizure, and then they kind of get back to themselves. So we call that the post-ictal period. And so depending on how long that post-ictal or post-seizure period is, most pets will return back to normal. The majority will return back to normal, unless there's more of a concerning cause with some other brain disease that's going on, and it isn't that idiopathic, in which case then we'd be worried about them not returning to normal, in which case then we get more concerns about something going on within the brain itself.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF.
So please, ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry. And I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jamila and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
So I read that you do some work with 3D magnetic resonance imaging. What do you do?
Yeah, so
how
it's
do you use
basically
it?
just a way that we are utilizing MRI to be able to do it so that we can get these really nice thin slices on MRI to give us a really nice image in less time is really the best way to describe it, so that it's less time for the patient under anesthesia. That's the main thing, right? Because if you think about it,
cool.
you and I were told, hey, lay perfectly still for an MRI, and we'll lay there, and sometimes we need something because we get nervous or claustrophobic, but our patients, they're not going to understand that, and so they do have to undergo anesthesia for the MRI. And so whatever we can do to maximize their time in the magnet, and I say that by meaning whatever I can do to limit the amount of how long they're under anesthesia for, and also know that I'm getting the images that I need to have diagnostic images.
Wish they'd knocked me out.
I know.
I know.
I honestly.
They wish they'd knock you out too.
I was good. I did it, but they
You
gave
were-
me a drug.
But I have a question. So if I have a dog that's never had a seizure before and they have a seizure, do I need to rush the dog to the vet right away, or what's kind of, how many seizures do you allow that dog to have before you say, okay, we got to do drugs?
If your dog or cat has a seizure, it's always good to follow up with your vet. Make sure they recover okay. I would call them and just make a regular appointment so your veterinarian can do blood work.
Okay.
Make sure nothing has changed, that's going on, because we always think too, a seizure is always originating from the brain, but it could be something outside the body, whether it's a low glucose or something that's going on that could make it so that they're having a seizure and making their brain unhappy is the best way to think about it. So it's always good after a seizure, follow up with your vet. My mentor, Dr. Denny O'Brien from Missouri, said everybody is allowed to have one seizure in their lifetime. He said it was like, that is what it is, but more than one, then we got to, really look more into it, meaning doing MRI or spinal tap or something along those lines. But after one seizure, just definitely call and check in with your vet. That way they can get them in to do some blood work and make sure everything metabolically is okay.
Wow.
Janet, I have to ask her this question because I just read about this, and I use prescription hypoallergenic diets for another reason. But this thing called paroxysmal dyskinesia.
Yeah.
Can you put that into lay terms? And
Yeah, please,
Yeah.
'cause that went.
I know, Janet, but this is
so
cool.
paroxysmal dyskinesia, it's a type of movement disorder. And basically we're trying to figure out in pets what potentially the underlying cause could be. And a lot of times we can't, but there are some dogs that actually have gluten sensitivities that can cause it. And so it has been shown in some. It's not most, but yeah, so there are certain breeds that can have gluten sensitivities, meaning we change their diet and we take away those abnormal movements that they're having. And usually that'll be something that'll come in, the owners are thinking it's a seizure, and then we find that it's a movement disorder.
Okay, so gluten, it's all of a sudden it's gluten this and gluten that. Are we just discovering gluten?
We're a little late in the veterinary community for gluten, though.
But you see what I'm saying?
Yeah.
Like you're hearing so many more of my friends. I found out I was gluten intolerant. I feel great. I didn't know. I guess it's okay.
Yeah, I mean,
Now, I want to talk.
it's science, and luckily the more we learn, right, the more we can figure figure things
it's
out.
so, I think it's so cool. I love when food can fix what's wrong with you. I love that. But let's talk about disc disease, because I love what you talked about in Frenchies and all those pushed in
Yeah.
breeds. Um,
Are they really called that, pushed in breeds?
So,
No.
I call them my low
Oh.
riders. But basically the best way.
They're
Yeah,
so
they're
cute.
so. I mean, I love
They're
them. I feel bad for them, honestly. So
Oh, yeah.
basically
Because we've created
exactly.
them.
And that's why, we're responsible for them and for their problems.
right.
And so that's why trying to come up with the best solutions for them, the poor things. So disc disease in general. So, there's
Yeah.
many ideas about disc disease out there, I guess is the best way to say it. It's become common nomenclature in the vet med, which is great. People will be like, oh, my dog has IBDD, which is wonderful. But a lot of times I'll see owners, they come in and they say, my dog's been diagnosed with IBDD, what do I do? And so IBDD stands for intervertebral disc degeneration, okay? All it means is that the natural discs that are in next to the vertebrae or the bones of the spine, they've taken a bunch of forces, they've degenerated. And usually when something degenerates, it calcifies or hardens. So normally you can think of a nice healthy disc like a nice jelly donut. This nice jelly center should be taking in all the forces to kind of protect the spine. Well, if you harden that, then it can't respond to those forces naturally.
Right.
Every dog, every cat, this happens, more so dogs, but in every dog, you take a dog off the street, they can have evidence of disc degeneration. So just because you take a radiograph and you see, hey, here's evidence of IBDD, it doesn't mean that it's necessarily going to be a problem. And that's what I think is like the one thing that I want owners to know, because they'll a lot of times come to me, their dog's totally normal, but they've been diagnosed with IBDD on x-rays, and they're so scared, And so what I always try to explain to people is, this is a normal aging process that is going to happen. Now, there are certain breeds, so our low rider breeds, or what we call our chondrodystrophic breeds, that degenerative process starts much earlier. So I have a dachshund. It's one of the most common breeds we see. I love my little dachshund, but I know when she was just 2 months of age, her discs have already started to degenerate. So it starts so young versus other dogs, they're 7 or 8 years of age. And so our dachshunds, our beagles, our Frenchies, which have taken over the world and is the majority of what we see now, corgis, those are the dogs that are classically we're going to present with disc disease. Now, that being said, any breeded dog can present with disc disease at some point where that disc is now a problem. So when I say that disc is now a problem, what I mean is that disc is no longer in its natural spot. So the disc naturally sits below the spinal cord. And if that disc misbehaves, it's usually going to go upwards. And what's up is the spinal cord. So then that disc can be pushing, what we call compression on the spinal cord. But also when it came up, it could have basically caused a significant bruise to the spinal cord. So what we call that concussive injury. And so you're dealing with two problems there. And that's when it becomes an issue. It's not an issue just because it's, starting to have this degenerative process, though of course we know, hey, this disc could be a problem in the future. But it's a problem when that disc starts to misbehave is usually how I'll kind of phrase it to my owners, so that they know, hey, and some people will say, okay, well, the x-ray showed that it was this disc that was calcified or degenerative on x-rays. Let's say it was the L23 disc, but we do an MRI and it's actually the 13-1 disc that is the one that's misbehaving and is causing a compression. So that's oftentimes too, I would say, hey, we can't go just off the radiographs. That's why we usually have to do more common advanced diagnostics, and that's where we'll bring MRI or CT into it.
So when that disc goes up, will it come back down
No.
again? And then the bruising will get better? It
So
just stays there.
It
keeps
stays there.
bugging
There
you.
is some that likely will go away and kind of get taken in by the inflammatory processes that will kind of start, the inflammatory cascade that will start. But not, it's still majority of it will be there. And so that's one of the most common reasons I see dogs is they can still be up and walking and doing fine, but these owners will say, I understand, my dog doesn't have severe neurologic deficits, but he's so painful and he's not responding to medications. And a lot of people think, well, unless my dog's paralyzed, I can't do surgery, which is so not true. I do surgery on so many painful animals because to me, it's all about quality of life. And you can't, if your dog can walk, that's fantastic, but your dog has got to be comfortable too. And if medications aren't cutting it, I will gladly look further into it and potentially do surgery. And there's a lot of neurologists out there that also feel the same. And so I think that's just a common kind of myth out there that owners, feel like, oh, hey, well, I heard unless my dog's not walking that they're not going to do surgery, which is not true at all. We might not come in at midnight to do it, but I'm gonna come in to make sure your dog is comfortable and taken care of.
Blue Buffalo natural veterinary diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo natural veterinary diets.
Can these dogs, is there physical therapy available?
Absolutely. Yep. So physical therapy is definitely something too that will kind of go on, part of the treatment protocol. So usually if you have a dog, let's say the dog is walking and just painful, we can try medications. So you can definitely try what we call medical management versus if things progress, they're paralyzed, they're really painful, they're not responding to medications. That's when we say, okay, let's look further into this with the MRI, see what we're dealing with. And if the compression is significant, let's go ahead and do surgery. And what's pretty amazing with dogs is that, say your dog comes in, they're paralyzed. They cannot move those back legs at all, but they can still feel them, something that we call pain sensation. They have an 85% chance with surgery that they can get up and walk again, which is pretty remarkable. So even, we'll have owners come in and, they're so distraught. And then they hear that number, of course, which is 85%, which is a pretty remarkable number for these paralyzed animals, as long as they can feel those back legs. So they can do wonderful.
So what do? You take the disc in surgery. You take the disc out?
So in the back, the most common surgery that we do is called a hemilaminectomy. And basically we make a little window in the bone, and we go in there and we scoop out, I call it the misbehaving or the naughty disc material that's no longer in its natural spot. So we go in, we scoop that out, we take away the compression from the spinal cord, and you leave that disc material that isn't, misbehaving and is still in the natural spot alone. But what we have to recognize is that there's now a hole in the top of that disc. And so we need that to scar over. So regardless if you're doing medical versus surgical management, one of the main reasons that these animals will usually need to be strictly rested for 6 to 8 weeks is so that hole has time to heal, so no more disc material comes up and starts pushing on the spinal cord.
Wow. Is it usually just one disc, or will you find that it's like the whole 3 or 4 in a row?
No, so it'll usually be one disc. Issue, so you had brought up French Bulldogs earlier. And so French Bulldogs are by far one of the most common breeds. I mean, it's not even one of, it is by now the most common breed that we see. And because they have disc disease. And one of the things with French Bulldogs that makes them they change the way we look at disc disease, I would say, from they're kind of in their own category from any other breed of dog that comes in, because they unfortunately oftentimes don't do as well in really severe cases. So what happens is that when they have a disc herniation, they usually also have a tremendous amount of bleeding or hemorrhage with it. And so even though they herniate one disc, they may have this huge blood clot that's expending vastly over many, many sites. So they usually need a more significant decompression, but also that means there's been more compression or pushing on that spinal cord. And so we call that epidural hemorrhage, or EH is sometimes what it's referred to. But we worry about that because usually you have the disc herniation, then you have all this bleeding with it. And so these Frenchies may have just had a little bit of back pain a couple hours ago, and now they're completely paralyzed. It really, really expedites the process where we say they kind of, quote unquote, they go down quicker. So they really are in any stage of when they potentially start showing signs for disc disease, more of an emergent nature. We always say, during my residency, it was kind of the rule of thumb, you never sleep on a down Frenchie because you want to give them the best chance, and the best chance is to do that as quickly as possible, meaning getting them imaged and then potentially surgery if that's what they need. And the harder thing with these dogs too is they're usually babies. They're usually 2 years of age when they have a disc herniation, which is much younger than our other breeds. And it's been suggested that they have a poorer recovery as well. And so that's something that's really, really hard too when you have this young 2-year-old dog and you're going to be saying, look,
for 8 weeks.
These poor things. And with Frenchies, we have the ones, say they have a disc herniation, they're younger, so less than 2 or 3 years of age.
unfortunately, they have a 50% chance that it can reoccur. And that's a big number for these
Oh,
people. They hopefully all, and I try to
yeah.
push everybody to have insurance on their dog, but either
I was
way,
going to ask you
yeah,
that.
either
Yeah.
way with Frenchies, it's a hard hit to take that you have this young dog you're doing one spinal surgery on, they recover, while they may have another one 1 year down the line, and that's really hard. Because usually about
Yeah.
50% of them are going to reoccur, and of those 50% that do, they usually do it within the first year of that first injury.
Wow.
So yeah,
How
so it's
sad
it's
is
really
that?
hard, especially if you have these people that this is their first dog, they just got a Frenchie and they don't know, but they're so
Yeah.
cute and lovable, and you're having to go through all this. So I'm so thankful for this podcast as well, just so it can educate people, especially any breed, but also my Frenchie owners, to know that this is out there,
Yeah.
because it's a very scary thing to discover, which is a lot of times when people do, and all of a sudden their dog is paralyzed and they didn't know that it could happen.
Oh,
Yeah.
so sad.
So Missy,
Especially,
what are
especially being so young.
what are you most passionate about in your work?
Um, I mean, it really is just helping the animal. Like, it's still like, and I think that's why I've kind of ventured to do my own hospital, is because I just want to be able to do things my way, help as
Yep.
many animals as I can. I do a lot of rescue work too, and I just that's why I ultimately got into it. I think that then you get into the hustle and bustle of veterinary medicine, and you can't always do things the way that you want, and so it's kind of nice as I'm aging that I can kind of get back to exactly everything that it was, and help, just feel like I can help more and do more
Love that.
for my pets.
What is?
Janet, I want to ask her about Dobermans, though.
Oh yeah, okay.
Because Dobermans have, Janet, this neck problem. Can you talk about that?
Yeah, so
Missy?
they get a condition called cervical spondylomyelopathy. It's also known as wobbler disease. And the reason it's called that is because they wobble when they walk. And usually what happens is their spine...
Really?
Mhm. Usually they're older.
Because the lesion is here, Janet, so anything below that is kind
Yep,
of funky.
exactly. So
Yeah.
usually what happens is the spinal canal, which is what the spinal cord runs through, it's more narrow than what it should be in the lower part of their neck. So kind of like right in their shoulder blade area is the best way to think about it. And so over time, as that spinal cord has been kind of impinged and pushed on, eventually it becomes a problem, usually when they're older. And usually what ends up happening is they'll have this little tiny disc protrusion with it, whereas opposed to kind of, I always say, like an exploding disc, that this huge disc, it's more of just a little bulge. And that bulge, plus kind of onto a spinal cord that's already been pushed on, is usually what will push these guys over the edge. So we call it disc-associated wobbler syndrome, or DAWS. And so those dogs oftentimes will potentially need surgery. It depends on what we're seeing on the MRI, but usually they'll need surgery when they start to be significantly clinically affected in all four limbs. Difficulty walking, some dogs can be completely down, and then the biggest thing, of course, is if they're painful.
So
Well, they
sad.
do have Dobermans have long necks like Great Danes do.
They do, and
You know what I mean?
Great
They're-
Danes get a different type of wobblers. Actually, they get fibrous
Oh.
one they happen more so when they're younger. Actually, so they're usually the younger babies that get it, usually less than 2 years of age, when we'll see those dogs, versus the Dobermans are usually around 7 or 8 years of age.
You know, Missy, I don't know how true this is, but I remember in vet school when we were drawing blood from a Doberman, they said never crack that head back like that.
Oh.
In case they have that to a mild degree, that you could really cause more injury.
Yeah, so my biggest thing when I let go, so I'm doing a lot of locum work right now at different vet schools and different hospitals, and something that I will always preach is never to do range of motion in a dog or cat cervical spine, because they can have some really bad disease going on in their neck. Like, they can have a disc herniation, but there's more room in the canal in the neck, so they may not be as clinically affected and only presenting for pain. And you'll never know. And so doing something like that can definitely be dangerous for them. And so I commonly will see dogs that have this luxation of their first and second vertebrae. It's called an atlantoaxial luxation. And this like follows me around. I don't know why. It's like this thing no matter where I go. But it's one of my favorite surgeries, so it's okay. But basically, they can present at any age. And so just recently I had a 6-year-old Yorkie who presented for neck pain, and it had had this waxing and waning neck pain, no other neurologic deficits. And in those little dogs, I'll always get a lateral x-ray and neutral spies, just keeping their head as is, just to make sure that everything looks okay. And there it was. This dog's spine basically went like this because its second vertebrae, as opposed to being nice and straight, was sitting up here. And so we had to end up stabilizing that dog's neck. But yes, to your point, anything like that, you can significantly make, any cervical disease that's present significantly worse with kind of extreme ranges of motion.
Some of these dogs must be in so much pain and we don't know.
They're
don't know
so
it.
good at hiding
It's
it.
so
They're so good at hiding it. And I will have, some of those owners that come in and they say, my dog is just not right. Like, there's just something, I can't say what it is.
Right.
I'll find a disc problem, we'll do surgery. They'll come in at their 2-week recheck and they'll just say, like, I didn't even know how bad my dog must have been affected, because this dog is barking at things. This dog is, like being crazy, feeling so good, or I'll see that in some of my older patients too. And people will say, I just thought my dog was getting old. And then they have the surgery and then they feel like they have a whole new dog again. So, they're so good at hiding it. And that's why, even if I don't find anything significant on my evaluation, I will always listen to the owners, because they notice these little things that we.
I love owners like that are so in tune with their pet. Well, tell Janet about Gulp.
Yeah, so
Gulp?
Geriatric.
Like a big gulp?
It's called.
No, this is fascinating to me
geriatric onset laryngeal paralysis. So basically what happens is, what you may first notice in your dog is that their back legs seem a little weaker, or they're kind of wobbly, and then they get laryngeal paralysis, which is basically where I describe it like their voice can't work appropriately. And so what happens is they can go outside, exercise on a hot day, and they can literally try to be like sucking in air because they can't breathe in and out air appropriately. And so that will present in our older patients. And a lot of times when they have that, unfortunately, it's more of what we call a polyneuropathy. So meaning that more veins in the body are affected. Our sciatic nerve is a very long nerve in the leg, and that one is affected. And then your recurrent laryngeal nerve also is a very long nerve that causes kind of changes in that, we'll call it the voice box, if you will, or their breathing changes. And so that's why we see signs in those first. Some younger animals can present for that. I actually, with Dr. Diane Shelton, we just found it in younger Great Danes, and that paper should be coming out soon, describing it then. So though it classically, obviously geriatric onset, laryngeal paralysis, polyneuropathy complex is technically the whole world, but we can see it in younger animals as well. And we start to get worried when the long one.
And there's really no treatment, right?
Unfortunately not. It's usually kind of supportive care. And so usually in dogs that are having difficulties breathing, they can have a surgery to kind of open up their airway so that they don't have that problem. Opening up the airway does put them at increased risk, though, for aspiration pneumonia. So there's all risks involved, but really for quality of life, it usually ends up being that we use sedatives to try to keep them calm in certain stressful situations. In regards to their back legs, because it's a degenerative process, there isn't anything, unfortunately, we can do. But in those instances, we'll definitely say physical therapy, trying to keep those muscles, keep those limbs as, healthy as we can, and utilize them as best we can, keep them as strong as we can, because unfortunately, they will continue to get weaker.
Wow. So I had sciatica, and I asked my chiropractor, is it sciatica?
Of course it comes back to
or is
you.
it sciatic? And he goes, it depends on the pain level. When it's really bad, it's sciatica.
That's a good one, Janet. I haven't heard
That's
you
a
tell
good
that.
one. And so I'd call him, and I go, I have sciatica.
Okay, now that it's about you, it's going to be about me.
Okay.
Missy,
Always about you. Always.
I know. And this is a good question because I don't understand it. Excuse me. When I blew a disc in my back, just reaching down to pick up a colander.
It was nothing to do with the dogs. I just want you to know that.
Right. But I wake up like at 2 a.m. The pain was radiating down the lateral side of my knee.
Yep.
That knee hurt more than anything. And I'm like, wait a minute.
Because it's all connected.
Those are the nerves.
Is that right?
Yep. So you basically have like a really bad neuritis happening. So inflammation of the nerve secondary to that disc. Yeah.
was
Yep.
horrible.
And that's
Absolutely
that's what we'll see commonly in our, we'll have some dogs present with really bad lumbosacral disease. So kind of at their, I call it their
Uh-huh.
tail base area is the best way to think about it. And they can have really bad pain from that, and they'll lift up a limb and just try to almost be holding it up because they think, is that going to relieve the pain? We call it a nerve root signature because they're letting us know, hey, first, of course, you're going to make sure it's not a lameness for another reason, but then we'll see them and then we'll say, okay, this is because, this poor dog's sciatic nerve is impinged and they're so painful. They're trying to hold it up to make it feel better.
So, Alice, were you holding up a leg during that whole time?
No, I have to tell you, my girlfriend came over, Kathy Rice, and I came out of the bedroom. I had pajamas on, but I thought, well, someone's coming over, so I put a sweatshirt on, walking with my husband's cane because he just broke his ankle.
Gosh.
And she looked at me and went, oh, Alice. And I thought, I must look pretty bad. But can I tell you, I not to get gross, but the worst part was it's hard to poop.
Yes.
When you blow a disc, you don't want any kind of pressure going on anywhere.
They asked you that question. Are you having pain during...
Nobody asked me that.
Oh, yeah. I've been
Can
a
I
human
tell you-
neurologist, and they ask you, and I'm like, actually...
Let me just tell you, the orthopedic person that I saw here, the whole appointment was talking about, asking me about his German Shepherd.
Yep.
Let's get back to my point.
On that note, I do want to ask about brain tumors,
Yeah.
though. Like, what is, obviously older pet,
Mhm.
right? I mean, the symptomatology.
Yeah, so they unfortunately can happen at any age, just like, in people, but definitely
Yeah, true.
we see them more commonly in older pets. And what makes them really tricky in our pets is that when we talk about kind of the brain, different parts of the brain, very easily we can talk about the front part, which we call the forebrain. We as people, use our forebrain a lot. And so we oftentimes will be able to know if we have a small mass in our forebrain because we'll start to do things. We'll go to drive somewhere and we'll say, shoot, where the heck was I going? Or, forget these little things and stuff like that. But with dogs, they don't really use their forebrain, or cats. And so the problem with that,
That explains a lot.
but the problem is that they can have these huge brain tumors in their forebrain and they're acting totally normal because everything that drives their daily activities comes from what we call the reticular activating system, which is basically in the midbrain portion and backwards, they're more hindbrain animals. And so because of that, they can do their normal functions, they can do everything, and unfortunately they have this large mass growth, and it's not until it gets to the point that it starts disrupting other parts of the brain. So whether or not they then will start to have a seizure. So it's very common in older patients that present, they present for seizures and they have this large brain tumor and they're otherwise totally normal because they don't use a large portion of that part of their brain. And so it's really disheartening for owners when they say, I'm with this animal all the time. The only thing that has happened is they just had a seizure and they'll come to see me and they know this pet. And unfortunately, we'll find something like that. And it's really hard because we almost wish they use more of that forebrain so that we could have clues earlier so that we can, be more helpful for a lot of these pets. Now, still, it doesn't mean, there's definitely treatment options depending on the type of tumor that we see. There's surgical options, there's radiation therapy. Radiation therapy is definitely kind of coming up as we see that it can be very similar to surgery. So in regards to expected outcomes, so if we can do that as opposed to a surgery, of course we would try that. And then, or there's palliative care. So meaning just putting them on medications to try to help support them as best we can. Usually that'll be steroids, anti-seizure medications if they need it, pain medications if they seem like they have a headache. But there are certain breeds, so kind of any of your smushy face breeds, your brachycephalic, so your boxers, your Frenchies. Frenchies, you can just plan on anything neuro they can have. Your Boston Terriers, those kind of cute guys, we do worry more so about them having certain types of tumors as well. And they can present more at that, that 7-8 years where they're middle-aged and you wouldn't quite say that they're older yet, unfortunately.
Yeah. And, I had Cindy, my 15-and-a-half-year-old golden, she was a rescue, because I help out golden treasures in Akron and then Southwest Florida goldens here. But she started, seizures and then was circling.
Yep.
Yeah. And, my internal medicine best friend, Dr. Ward, I called Heidi and she said, Alice, you know what this is. And I knew. And then the seizures became, they didn't stop,
Yeah.
and so that was our decision.
sorry.
But isn't it true they can circle in the direction of where the tumor
Yeah,
is?
so basically if they
Really?
have something going on in the front part of their brain, so let's say that they have something
Yeah.
going on in the right part of their forebrain, then they'll circle towards the right. And the reason that they'll do that,
Yeah.
and they're usually big, wide circles, not like teeny tiny, tight circles.
Right,
And the
right.
reason they
All around the dining room, yeah.
Really?
The reason they'll do that is because your right side of your forebrain controls the left side of the body, and vice versa. So they basically can't direct any attention to the left side of their body when they have something going on in the right part of the forebrain. So we'll check, what we call their CPs or their knuckling abilities, is sometimes people refer to, where we'll flip their paws over and make sure they flip them back over. So we'll see deficits sometimes just on that side of the body. Some dogs will eat only out of half of their bowl, so they'll literally draw a perfect line down their bowl, and they will just eat everything on the right side, but
Oh my
leave all the food on the left side.
Now, what about a brain tumor in cats? Does that present the same
Yep,
way?
so kitties will present the same way. I will say they'll present the same way, but my rule with cats is they can do whatever the heck they want. So
Yeah,
they
that's
throw everything. You know
All
what I mean?
bets are off.
They throw
Smart,
everything.
smart doctor.
Yeah, I can think I know stuff, and then a cat walks in, and I'm like, oh, you just threw
Yeah,
me.
that's right. You're wrong.
But yes, they can present as well. That I won't say the nice thing about cats having brain tumors, but kind of, if we're looking to put a positive spin on it, is that they commonly will get a type of tumor called a meningioma, and if they do, we are more likely to be able to completely surgically excise the type of meningiomas that they have, versus in dogs, we always know we're kind of leaving behind some sort of residual disease, even if it looks like we got everything perfect. So in cats, the nice thing is that surgical removal of the meningioma actually could be curative for them.
And those are slow growing, aren't they?
Yes,
Meningioma.
we have the number of times we've gotten reports from dermatologists that have done a CT or something, and they say, "Oh, incidental meningioma," like finding.
Whoa.
And some of those owners, they want to monitor it because their pet isn't showing any signs, and we'll monitor them
Right,
for years.
It's funny because the name of a brain tumor and the word incidental somehow
I
should
know,
never
right?
happen.
Exactly. I get it all the time, and it's just, they were presenting because they were vestibular, and they presented, they've had otitis media, and then, oh, by the way, you have, this meningioma in the right frontal lobe or something. Wow.
My girlfriend had a meningioma. Janet, remember when I lived on Granger Road? Joan, my neighbor, she was unloading the dishwasher, and she just fell over in a seizure. And of course, her husband, who's Italian, was like, "Joan, what are you doing here?" And so I asked her, and she ended up having 2 surgeries because I don't think they could get it all the first time. But I said, "Joan, how did it feel to have that seizure?" She said, all I could hear was Frank in the background yelling. She said, "I didn't really have any feeling at all." And I was happy to hear that, because I always wondered, you see this horrible thing happening to your pet, and it's not like they are feeling anything, but they can still hear.
Yeah.
Yeah.
And I think that's a really good point, is, they may, especially when they're first going into it, and then when they're coming out of it, I do think, I tell my owners, just talk to them. That's the best thing you can do, so that when they're coming out of it, they can at least hear your voice, because they can be discomforting. They may not be able to see yet. They still may not know what's going on, but of course, hearing your voice will definitely cause, just allow them to have that comfort while they're figuring things out.
Well, Alice, we got to wrap it up. We
I
can
know,
keep
but I have
going.
one more question.
Oh my
I have one more
God! And
question.
it's going to be a big word.
No, it isn't, because I can't remember the name of it, but Missy will know it. Okay, I had adopted a golden collie mix, Nellie, and she was a year old, and abruptly she went down. And it was that, what is it called, where the embolism of the disc, or the,
So a
I can't think of,
fibrocartil-
and then she got,
fibrocartilage.
Sounds
Yeah.
like it exploded.
and tell Janet what that is. But then she totally recovered, but she actually still, if I would touch her one shoulder, seemed very sensitive there.
You mean
I don't
she
know why
went
that
from
was.
walking to?
To down.
Yep.
Oh.
Yeah, and then I'm sure she got back up again after some time. Yep.
He did, and nobody at the time knew what was wrong with her. But then after I went to vet, I wasn't a vet then. Then after I went to vets, going oh my God, she had this FCE. Yeah. So would you explain
so
that?
basically I describe it like a stroke to the spinal cord. So the most common scenario is you have, that I hear, is you've got dogs.
Young
outside.
dog.
Yep, younger dogs, usually large breed dogs, so it can happen in smaller dogs too, but they're outside playing. All of a sudden, the owner hears this high shrieking sound. They go outside to find their dog dragging their back legs or dragging one back leg, not necessarily another. And usually, though, that it's painful when it first happens, but then after 24 hours or so, they shouldn't be painful. They shouldn't have any back pain. But what happens is a little piece of disc kind of breaks off and ends up obstructing the vessel that goes to the spinal cord. So it literally is a stroke. And it usually is more on one side than the other. So usually there will be worse on the left side or worse on the right side. So we'll call it an asymmetry of signs. But the good news is that those dogs can do phenomenal. As long as they can feel those back legs, those dogs have an 80 to 90% chance for getting up and walking again. And it can happen in the neck as well. Miniature schnauzers are the classic neck FCE.
Oh, really?
Yep. And
Good to know.
So that, and then the other thing too that presents very similarly now to an FCE is what we call, so with IBPD, you have your type 1, which is when that disc really explodes or herniates. Type 2 is more of that bulge, and we call it type 3 now, which Hansen wasn't around there, so technically it's the type 3, but you'll call it type 3. And what we call it is an acute non-compressive nucleus pulposus extrusion. I know, Janet. So what that is basically some healthy nucleus, so that healthy jelly part of the disc, a very small amount of it will come up very abruptly and basically punch the spinal cord is the best way I can think about it. So it bruises the spinal cord, but then it goes back down, and because it's only a small amount, there isn't any compressive component to it. So these dogs don't need surgery, they need time, but they're treated very similarly to an FCE because they'll be painful for the first 24 hours or so, and then luckily everything kind of subsides, inflammation goes down, time and supportive care, and they can do quite well.
Boy, that would be a lucky thing to have.
I actually had one of a technician I used to work with. I was in St. Louis last week, and she has a wonderful working German Shepherd, or actually, Belgian Malinois. And she brought the dog down to see me last week. Drove 8 hours to get an MRI with me, and that's exactly what he had. So it was it's one of those worst case scenario because you don't want them to have a disc problem, but best case scenario because he doesn't need surgery and he should be able to get back to working after 6 to 8 weeks, which is good.
And you could see that on the MRI.
So basically what we see is, when we're looking at the MRI, that nice jelly center, that nucleus that we talked about, it should be nice and bright. And what we see is we compare it to other discs, there's less of it at that site, and then you also can see a brightness of bruising the spinal cord on the MRI.
Wow.
Isn't that amazing?
Yeah, MRI is definitely the way that we practice veterinary medicine, that's for sure.
Wow.
I just think neurology is so fascinating.
Me too.
It seems to me that it's like changing every day,
Absolutely.
I mean,
I
really.
learn things, honestly, every day. I'd be lying if I said that I didn't, even as long as I've been doing it for. So it's really interesting. It keeps you on your toes. You'll kind of have the standard things, the straightforward, and then all of a sudden it throws you for a loop and you're just figuring things out and learning things as you go.
Like the gluten thing, Janet.
Who would have thought?
Yep.
I know.
Yep.
Wow. Well, thank you so much. This is so
I'm so
informative.
glad you agreed to do the show. It was so nice meeting
really
you.
nice
And
meeting you.
again, I love the podcast that you run. And of course, I love our podcast too.
But we have to ask you our guest question. What is your pet or human peeve?
Yeah.
What is my what?
Pet or human peeve?
Pet peeve.
Pet peeve. Or could be about a human.
Yeah.
Oh.
What bugs you?
To me, it's noise in a coffee shop.
So all my stuff goes back to neurology. So it's kind of all neurology stuff, but I personally don't. What drives me nuts as a neurologist is when people say that a dog or a cat is non-ambulatory paraplegic, because plegia means there's no movement, there's no motor function. Right. So if you're saying non-ambulatory paraplegia, it's just you're saying it twice and there's no need for it. So that is one of my pet peeves. Another pet peeve that I know my technicians are going to give me, they're just going to say, why didn't you say it, is a fontanelle is an opening of the skull. And so a lot of times people will say open fontanelle.
Open fontanelle.
That's what. So that's the other thing. And those are just my little things that I just, everything's neuro.
So Missy, I hate when I'm a customer and someone says no problem, because it's no and problem both are negative.
Yeah.
Oh, I never
That's
thought
like
of
a
that.
big no in the customer service world, and I literally like the hair on the back. I just go,
Okay, so mine is instead of pruritus, puritis. And
I never
some
use that word.
dermatologists say that.
Never.
And I have to say, now that I'm retired and I go to the beach for walks and I listen to podcasts and webinars, when I hear puritis, I'm like, beep, going to a different one.
Missy, it's been a
thank
pleasure.
you
Good
so
luck
much.
with your
Thank you so
practice.
much.
Wishing you a ton of success.
Thank you very much.
And thank you
Yes,
for the
I'm
work
so
you
happy.
do.
Thank you
you.
so much. This was great.
This is Dr. Alice Novotny-Jeroman and
Janet Novotny King saying thank you for listening. We appreciate you tuning in. Don't forget to share us with our friends. Send us your questions, and we'll put some of those big term words on the screen for you. Thanks. Bye-bye.
bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.